Good morning. Welcome, everyone. Welcome to the fourth session of the Nursing on the Frontier Lines of the Climate Crisis, Education for Action. Good morning, good afternoon, good evening. We're so happy to have all of you on session 4. Session 4 will be on extreme weather, hurricanes, and flooding. The course schedule is here. Many of you have attended the first 3 sessions of the course. They are available asynchronous on our website. So please, if you're interested, consider attending those. And as you can see, we have 10 sessions, and the course will be finishing on December 3rd. For attendance confirmation for all participants and continuing education credit for US-based participants will be provided for both live and asynchronous participation. For live attendance, individual attendance is automatically recorded during the live Zoom sessions and video recording views. Your attendance is not counted if you join with a colleague's link. For asynchronous attendance, video recordings of previous sessions are available on the Alliance of Nurses for Healthy Environments platform. In order to receive continuing education credits for the course, there is one continuing education credit available per individual webinar. Participants must have attended the live webinar session or view the recording and receive at least 80% of the post-session evaluation. Participants who attended the live webinar session on Zoom will be provided a password, which allows them to bypass the video viewing requirement, and the email will be from Columbia University. Please allow 2 to 3 days following each live session to receive this email, and check your spam folder as well. For the session logistics, the session today is 60 minutes. We do plan to have question and answer at the end of the session. Please enter your questions for the presenters or the presenter in the question and answer, not in the chat. Session video recordings, slide decks, and resources will be available on the course website. And we encourage you to engage in the link for the chat during the session. So our speaker today is Dr. Barbara Sattler. Dr. Barbara Sattler is Professor Emeritus at the University of San Francisco and an international leader in environmental health and nursing. She has advised the U.S. Environmental Protection Agency and the National Library of Medicine on environmental health. She also, through the California Nurses for Environmental Health and Justice, she educates nurses on climate-related risks. With over 20 years at the University of Maryland School of Nursing, she directed the Environmental Health Education Center. Leading initiatives included environmental justice, community research, and greening healthcare. Dr. Sattler is a registered nurse with a master's in public health and a doctorate in public health from Johns Hopkins University, and is a fellow of the American Academy of Nursing. Please join me in welcoming Dr. Barbara Sattler. And these are the learning objectives for the session. Again, our session today is on extreme weather, hurricanes, and flooding.
Thank you, Karen. And I am delighted to be here. Can somebody just confirm that they're seeing my first slide here? Yeah, thanks, good. And I think that I would like people to know, I see that there's somebody from Ghana. I'm so delighted to see that, that my presentation is globally relevant. I will be using a fair number of US examples, simply because we've had some very, very recently that are relevant to my talk. But I hope that you will see the relevance for people all over the globe. So this is the general direction of my talk here today. I'm going to whip through these things in a lot of ways because it's a lot of information for a short period of time. We'll look at the causes of the extreme weather, the hurricanes and floodings, and about categorizing them. We'll look at nurses' roles, because after all, that is really, I think, one of the main goals here, both personally as well as professionally. How do we shelter people from the storms? Who are the vulnerable populations to storms? what kinds of resources there may be. What do we do at cleanup time after the cameras have left and now the community is left with a royal mess? What do we do then? And what's our role for nursing? What's the new normal for people in our communities? And then the implications for nursing education, a case study, and questions and answers. So the first thing to ask is, why are we so wet and stormy? And the reason for this is primarily because our oceans are warming up. And one of the things I never thought I would have to learn about as a nurse is these things called gyres, Gyres, that are these tidal movements in the ocean. And there are two sets of them. And the bottom left is the larger, longer one that takes actually several years to go. And it brings the cold water from the southern tip of the Earth and slowly brings that up into three loops, which you can see. It's almost like our circulatory system. And then there are these smaller gyres. For those of us who have ever heard the expression El Nino, these are created by the North Pacific gyre when wetter or less wet water, warmer or less warm water comes through. What you see here is reflected by these smaller gyres, where we are beginning to see increasing levels of quite catastrophic storms, both hurricanes, cyclones, and then, of course, typhoons. And these have been increasing largely because we've been warming the oceans. And very specifically for those who are in the US, you may, if you watch national news, may have seen a picture very similar to this on your television. And if you look at the bottom left, what is in orange and red there is the Gulf Coast, and then, of course, the Atlantic Ocean. And that little piece down that says Tampa in there, that's our state of Florida. And you can see the red area is where the Gulf has heated up. And when storms go over this warmer water, they carry more water with them and they also speed up. And that's exactly what happened with Hurricane Milton in the last few weeks, which came on land as a Category 4. So the global warming impacts include the fact that they are providing more energy and water for the hurricanes. The evaporative processes heat up the air. The storms are then pulling more of this water up and creating stronger and heavier rainfall. And then in areas where you have tropical cyclones, this is really creating the possibilities of these superstorms that we're seeing. And the tornado that you see in the bottom right was one of the tornadoes a couple of weeks ago that was part of Hurricane Milton's storm. But what we see then almost immediately are these incredible pictures of the really horrid destruction that was done. Obviously individual homes, but also infrastructure, the roads, the power lines, the communication systems, and other things that are destroyed. And this is where our understanding of preparedness, response, and recovery are really important to nurses and to our communities. The hurricanes, you may not know this, but hurricanes are categorized in part by their wind level, but more so by their capacity to destroy. We've had very, very few Category 5s, but Katrina was one of the first Category 5s that we had in a very long time in this country. And that gave us a sense of the incredible dire consequences and how we were not prepared. We've seen 1 through 5 more often, but we are going to be seeing more Category 5 hurricanes. Katrina created the conditions for mass destruction and mass displacement because where Katrina hit, there were levees that protected communities, and those levees were breached. So whole communities that had been protected by levees then got flooded. There were 1,392 deaths. We haven't seen deaths like that in the US from hurricanes since, because when Katrina hit, we were not prepared. $125 billion in damages was estimated at the time, and many, many thousands and thousands of people permanently displaced. So how can we best prepare our communities as nurses? How can we prepare our patients, ourselves, for these disasters that now are predicted to continue and to get worse? And so the very first thing I want you to think about is, what would happen if there was some extreme event that was coming your direction? What do you have in your car? What do you have ready to go? And so putting a go bag together is a part of our personal preparation. And each family member should have one, and that includes the pets. So there's not a one size that fits all. And also have batteries and a radio. This is going to help you at that moment when you've got very little notification of perhaps a levee that just broke, perhaps a dam that is going to go down, perhaps any other kinds of things that might be the result of an extreme storm. These are very practical things I'm going to be sharing with you right now. Everybody should do this in their home, including your patients and community members. You could work with your faith-based organizations to have people help each other do this. You should video and take photographs of everything in your house, your whole house, indoors and out. This is really going to help if anything ever happens to your property in order for you to get insurance on everything. You can create a home inventory. And this is something that, for instance, you could create an opportunity in your local library to teach people how to do this. This is something where nurses, as in our civic engagement, can help the community get ready. Some of our insurance companies have home inventory booklets, and this one on the right is one from an insurance company. So writing down everything in your home, and I can't tell you, I live in an area where we have both floods and fires in Northern California, how helpful having this list is after devastating events. This is another thing I really want to encourage people to have, because you could even just have a home fire that destroys your home. It doesn't have to be necessarily a Category 5 hurricane, but have a what's called financial first aid kit as well. So make sure that you have all of your information, take photographs of documents and store it in the cloud. This can be immensely, immensely helpful for people who are in the line of risk for storms. So what is your plan at your house? Do you have an emergency exit from your home should the bottom either be flooded or there be a fire on the first floor? Do you and your family members know the emergency routes from your neighborhood? Do you know the alternative routes should trees be down or other things that are going to be blocking the way? Does your family have a gathering place? Do you have something established? Do you know where your children will be taken if an event happens during school time when you're at work at another part of town? And then, of course, for any of you who also are in rural areas and have large animals, do you have a plan for where you're going to be taking or moving your large animals? Note that cell phones may be down or might be superseded by emergency personnel. In preparing for the evacuation, and we've learned this in California from evacuating for fires, err on the side of leaving early. And we saw this more recently with people evacuating from Florida, parts of Florida. Traffic happens, and you don't want to be stuck in traffic looking at a hurricane coming at you. Pay attention to the news all the time while you're evacuating, because that's going to help you with traffic patterns. And then double up in cars, of course, less cars, less traffic. The other thing to note is that in different parts of the world, in different parts of the country, there is different language for evacuation. In some instances, they may call the first level voluntary, the second level mandatory. In some places, they call it precautionary and immediate threat. So know what the language is. And then In addition, sign up for your emergency alert system, whatever that is in your particular country, your particular county. There is undoubtedly some form of an alert system, some app that you can get on your phone. Make a list of your first grab valuables from your home. In my instance, it's even though my children are grown, it's my children's artwork. That's what I could never replace, and I have it up on my walls. Have a first aid kit in your car. Have things that are important to you backed up to the cloud. My Grandma O'Reilly's Irish soda bread recipe is something that I want to pass on to my kids and grandkids. So that's in the cloud right now. And then, of course, getting involved in your neighborhood groups. Know that at this point, post-Katrina, the federal government and many state and even local governments have put much, much more together, many more resources. If you go to ready.gov, you'll see, and the bottom banner there is actually the top banner. When you go to ready.gov, you'll see resources for you, and Ready Kids has lots of great resources that you can be helping school nurses bring to children to prepare them. Then know what your role is in your workplace. If you work for a city or a county or a state agency, you may automatically be a disaster response person. That may actually be part of your responsibility. And so important for you to know that. And it may be written into your job description in other places as well. Nurses who work in nursing homes, for instance, where other staff, relief staff may not be able to get there. Also, know what organizations are involved in your communities for disaster response. I'll talk about that in a second. In the United States, through FEMA, the Federal Emergency Management Agency, and through the what's that agency that's for national security? They've created, in combination, a community emergency response team program. And any of you as nurses can participate in these community emergency response team trainings, and they're wonderful. They'll connect you to what's going on in your area and who's responsible. You'll meet the firefighters and other emergency response people. Very good way to just get information. You can also join disaster response organizations, I'll talk about in a minute. So one of the things I truly encourage you to do is request to see, if you work in a hospital or at a university, to see their disaster plan. So this picture of this hospital in the top left was when Hurricane Helene, just in the last month or so, this hospital was underwater. What was the plan in that hospital? And these two pictures that I've shown here, the one on the right, that's my hospital. That's Kaiser Hospital in Santa Rosa. They evacuated that and the Sutter Hospital in the middle of the night as flames, not a flood, were lapping up against the wall of the hospital. Every single person in that hospital was evacuated. So imagine now what would happen in your places of work if you had to evacuate everybody. There needs to be a plan. These are some of the ways that you can involve yourself in disaster engagement. One of the things we noted initially with Katrina and with other events is that you can't just show up and say, I want to help. People need to be already in a system. We need to have verification of your professional licensure. And so any of these, and in your communities, there may be others. So the International Red Cross, Salvation Army, which is in other countries as well as the US. In the US, we have the Medical Reserve Corps, but we also deploy them internationally, and Doctors Without Borders. It doesn't mean that every time there is an event that you will get deployed. It means you're in their system, and then you have first right of refusal to not go to an event, but you will have been trained, and they will be able to then engage you meaningfully when there is an event. The first thing that happens after a flood, after a dam or a levee breaks, is that the community self-organizes. This happens before the Red Cross, Salvation Army, or any of our government agencies get there. The churches in the area, other faith-based organizations, schools open their doors, and we start to house people in safer places. That self-organizing will be enhanced and helped if you, as a nurse, have some understanding of how to help create a shelter. And then, of course, being involved in an organization like the Red Cross or these others that I've mentioned will really help you bring that infrastructure to the shelters. Very, very important, because for some of these people in the shelter, their home was completely destroyed. That means they're not going, in quotes, home anymore. And the other thing that we're seeing, and we've predicted now for decades, is that we're going to see climate refugees, and this is only going to increase. The top right is another levee that was destroyed by extreme weather, and the community, the top left, this is a community that's being evacuated because their community is now underwater. These folks did not have homes to go back to. They become climate refugees. And we are going to see thousands and thousands more of these folks and are going to have to figure out how to rehome them. These are pictures from Katrina. When I went down to do Katrina relief, we had 2 small towns where we were sheltering 20,000 homeless people. The top middle is a picture of people literally parking their car because they saw a barn on the side of the road and bringing all of the things they had in the car into the barn because they needed to get immediate shelter and they had no place to go. And so that Katrina really was a lot of chaos. The main organizations that helped us tremendously in the Deep South were the churches. They have really big churches with gymnasiums and with commercial kitchens and all the things that we really needed to shelter people. I want you to think about where you are geographically. Where would you safely shelter people? Where are there places large enough? Where are there places that might have kitchens where you can then prepare food for folks? The other thing that is really important is now we had to deal with 20,000 people. Any little town or city of 20,000 people is not uniformly well. There are people who are pregnant. There are people who just had a baby yesterday. There are elderly frail. There are kids that may have been separated from their parents, and now you've got to stay with those children and make sure that they're safe. There are people with mobility issues. There are people who have the flu. So all of these things create the vulnerable populations that we as nurses need to help take care of in our communities. The other thing I want to note quickly is that many people leave without or have to leave without their medications. And when you've got folks that are critically reliant on their medications, for instance, diabetics and their insulin, we need to know how we can get them their medications quickly. The other thing, and I want to just quickly note this, is often people want to make donations and you don't want to be inundated with donations. If there's something specifically you needed, so for instance, in one of the fires that happened by where I was, what they needed were cages for animals. These were for pets. They asked for this over the radio, and people brought them to the high school where they were helping to take care of pets. But unless there's something specifically being asked for, do not encourage people to bring quote unquote, sort of random donations. These are the lists of, I teach a course in disaster preparedness. These are the vulnerable populations in gross terms and specific terms. So people of low income, people with limited English, immigrants often with limited English, indigenous populations that have often less resources, children and elderly and pregnant women, people with chronic diseases. For instance, I mentioned about diabetes and need for immediate medication, but also you may have people who need dialysis. And so how are you going to make sure you can get them to that? physical and mental disabilities, and incarcerated people, because the jails may also be impacted by these storms, and recognizing how we're going to be caring for them, and obviously homeless people. But these are another group of vulnerable populations. And when I did Katrina relief, we had a whole church, and all they had there were women who were about to deliver because they were 9 months pregnant, or women with newborns. And that was all that was allowed in that church area. Obviously, they could come out whenever they wanted, meet with their partners, support, people, etc., but creating a safe space for them. But in terms of vulnerable population, also people who are addicted, that's going to be part of your population. People with severe mental illness, and this I learned from the Red Cross, you want to cull people from the herd if they are exhibiting severe mental illness symptoms. You want to be bringing them away from the herd, who are already all deer in the headlights, and create safe spaces for them. Rural populations, I mentioned again, incarcerated, people who are in home hospice care. How are we going to transition them to safer places in their last hours of life? And then people in the LGBTQ community who may need sheltering in a specific way, farm workers, and people in skilled nursing facilities. We also need to recognize that first responders and rescue workers need our attention, if not during this time, then afterwards. Many of them suffer from post-traumatic stress, as does everybody that's involved in this, but they often think of themselves as immune to that. And then obviously pets and farm animals. What we need to understand is that there now are better systems in place, but they are not perfect. So understanding what is available in terms of recovery services, financial support mechanisms in your local area, state, your federal, your countries, whatever country you're from, what are the mechanisms? And this sign that says Multi-Agency Resource Center was put up on one of the floridadisaster.org sites and was updated regularly after the 2 big hurricanes that just arrived there. This is something that nurses should have at least, in their back pocket. The other thing to note, once again, is that there are a lot of resources. The National Library of Medicine has reached out to libraries all over the country, and the Department of Homeland Security has helped to beef up internet access at libraries so that these can be places where people can go in and use internet if the whole community is down, and there are no other ways to do that. But there are now whole research programs on researching disaster response. There are information centers. And so people should know, nurses should know, that there are almost infinite amount of new resources now. This particular set I put here, some of them refer to fire, but if you look at the second bullet, let's get ready, planning together for emergencies, that's for children, and it's a wonderful way to introduce children in our communities. Ready.gov for kids, once again. These are specific for our children, and so nurses can initiate programs in the communities that may be in the path of fires, floods, levees, dams, one way or another that we're going to be seeing disasters. And then there is the point of reentry. People want to go back immediately to see what's left of their homes. And this is a very, very difficult and emotionally traumatic time. And it's often a time when the cameras have left and there's not a lot of interest in continuing to focus on these communities. These community members now have to deal with trying to figure out what the resources are that may be government resources, try to get in touch with their insurance agents and figure out what needs to be done there, try and find their neighbors and develop a new support system. create an internet listserv for each other, doing all kinds of things to help reconnect them and help support them through their new reality. If they want to return to the flood scene, it is really important that we give them information on how to do that safely. We need to help them understand if recovery is possible in that area, and if not, how to identify longer-term housing. And really importantly, getting their kids back to normal, in quotations here, as soon as possible, which often means getting them back to school. And that may mean they're going back to a new school. Once again, the emotional trauma on whole communities cannot be overemphasized. And then there's dealing with insurance. And I need to note here that there is a huge social justice issue when dealing with renters versus homeowners. And then all of these folks are living with their new reality and adjusting to them. The other thing to note is that the insurance industry has in fact pulled out, the homeowner insurance industry pulled out of some communities because of the increased risk of climate-related catastrophes, and other states may be following. This is very, very important because in order to buy a new home, you have to have, in some instances, fire, in some instances, flood insurance, or both. And so this is going to add an economic and emotional burden. Just the week before last, in the United States, the Small Business Administration, which provided disaster funds for small businesses, were out of funds. And so Congress has to add more money to that fund. I'm pretty sure they're going to do that, but this is really important. We do not have infinite resources, and it's a single pie. And as we continue to cut larger and larger swaths from that pie because of climate-related disasters, that's going to mean less money for other things that the federal government ordinarily pays for. And so what we also know is that these catastrophes, and once again, I apologize for being US-centric here, because we know that these catastrophes have cost millions and billions of dollars all over the world, but our Federal Emergency Management Fund is almost out of funds. And if you live in a community that might ever require FEMA funds, we as nurses need to be making sure we are supporting the FEMA management fund, having enough funds to take care of people when emergencies happen. So another thing that's very specific to ask is, what is in floodwater? Well, it's pretty bad stuff. It's got human and animal sewage. It's got oil, diesel, gasoline. It's got dead animals, chemicals from people's garages, sheds, local commercial activities, local dry cleaning establishments, industries in the area. It's got household products. It's got bacteria, viruses, and spores. It's a mess, and people are walking through this. This was one of the things in Katrina, because people were walking for hours, sometimes a half a day in this. And many of the people that we took care of had very bad sores and swollen legs from walking in this. I don't think there's been very much looking at the longer term aftermath of what was in these floodwaters and then deposited on our lawns, on our decks, and what have you. This is a picture of a home that experienced flooding. You can see where the flood line was. There was pretty significant mold here. One of the things to note is that not all mold which is black is Statiboxa. I'm not pronouncing it, black mold. Stachybotrys, there we go. Not all black mold is Stachybotrys, which is a very dangerous mold. Most black mold is some run-of-the-mill kind of mold, but the CDC has the Centers for Disease Control has very specific recommendations for how to clean up after you've got flood waters in your homes. They recommend starting with soap and water and then moving towards a bleach solution of 1 cup to 1 gallon. And they've got very specific information. You see the website here about how to clean up after there's been a flood. Another thing to note is that when professionals come in and do cleanup, they're going to have Tyvek suits, they're going to have respirators on, they come in fully equipped. And yet homeowners, when they go in, may not have those same kind of protections. And in many communities, they bring in day laborers who are often immigrants, people of color, to help with cleanup. And now people are referring them as second responders. These are folks that we need as nurses to be taken care of as well. We need to be making sure that there are provisions for them to have protective equipment and masks and gloves and so forth when they're going into people's homes or commercial buildings to do cleanup. Another thing you might not think about is that because we lose energy. I can't remember how many, I think 3 million people in Florida didn't have energy. People then try to use generators if they have them. And this is a problem if they bring the generators inside a home. Carbon monoxide can happen, fires can happen. And so it's really important that people know how to use generators when the power is out, and that the generators be outside of the home, and then they wire into the home with extension cords. Do not have the generators in the home. The other thing to note is after these storm surges and floods, that we've got a lot of vectors that are going to increase in the area, that we're going to have long-term situations where roads may be out. This may be the one road that people could use to get to an obstetrical unit. Now, somebody who is pregnant is going to have to go 2 hours more when they're in labor in order to get to an obstetrical unit. So these various things can be created after these floods. Really important to get rid of any standing water, because that's going to be places for mosquitoes and other vectors to grow. And then decisions have to be made, and these are very hard decisions for people in the community. Do they rebuild or they relocate? And lots of people from Florida, once again, just in the last few weeks, were asked whether they would go back, whether they're going to leave Florida. This was 2 hurricanes in a row that came to some of those communities. And so it's a very big decision. The mental health issues during and after these storms are very significant, and we should be aware of them. And typically children start to experience these sort of symptoms of PTSD 6 months after or so, when they will start acting out in school, where they will be showing other kinds of acting out at home as well. And so it is not unusual. This does not mean somebody has a diagnosis of a chemically related depression. This is a reactive depression to a catastrophic event in people's lives. And so depression, numbness, anxiety, and then also re-triggering, especially in kids, when they see in the news another flood or another fire. I want to connect all of this to climate change, of course, but I want you to check out your local climate action plan. And your country, city, state, county probably has a climate action plan. What does it say about disaster planning in your climate action plan? What does it say about disaster response? What do you see as the nursing role, your nursing students' role in these in the disaster elements of the climate action plan? I do want to note that in some areas, there are unique challenges because they are resort areas where suddenly over the summer you have this bolus of people who are homed in cabins and in other kinds of facilities or campgrounds and other special events like and often in rural areas where you'll have festivals where you've got large numbers of people coming in. And what happens when there are flash floods or tornadoes or other things that happen in these areas? So if you're in one of these areas, this is something that you need to pay attention to. Now I just want to talk about what I see as nursing education deficits. I know that those of you who've been doing climate change work recognize that climate change is not a required topic for nursing schools. And unless you've got nursing faculty who buy into it, it's probably not going to be covered. Disaster planning, response, and recovering are also not required topics. And I have to say, I've done some work with my colleague Azita Amiri, who's at the University of Alabama in Huntsville, and they require their undergraduate nursing students to also concurrently get a certificate in disaster nursing, which I think is brilliant. And I think we may want to think about that as well. Incorporating disaster certificates into our undergraduate nursing programs. And then also heat, fire, smoke, flooding, absent from most curriculum. And yet, what's interesting to me is that nurses are often not considered when communities are pulling together emergency response and disaster preparedness. We're kind of a minority as opposed to the majority of people they think about there. So my recommendation is that we add this to curriculum and that we add recovery as an important component of that and tailor it then to our locations and our locations' risks. Currently, my colleague Susan Wilburn and I are doing a project for the World Health Organization, developing recommendations for health professionals globally, what kinds of competencies we need in order to be addressing climate change and its attendant risks. And so early in 2025, we should be having those materials available to you all. And something also to consider is in planning for disasters, how can we surge our nursing faculty so that they can be helping with setting up and developing the shelters, particularly the medical shelters, if we are evacuating hospitals, if we're evacuating nursing homes, and then also thinking about how do we utilize our facilities, pardon me, for medical shelters. We've got sim labs, we've got gymnasiums, we've got all kinds of things on our campuses. Thinking about that, and then practicing and having drills. Really important at your hospitals, seeing what your disaster plan is, making sure that you're drilling in your universities, and even at your faith-based organizations, practicing drills so that everybody knows what their roles are, how you're going to communicate with each other. Critically important. And now I'm going to share just a couple of quick case studies with you around this nurses preparedness and nurses building resilience in our communities. So folks often say, but I don't even know my neighbors. Well, the next two case studies are about getting to know your neighbors and addressing climate change and developing the capacity to be more resilient to storms and other catastrophes. And the woman on the far left in this picture is Lisa Hartmeyer, and she lives in a community in San Francisco. And she, pardon me, she engaged her block, just her block, in something called the Cool Block Campaign. And what this meant, if you go to coolblock.org, it gives you all the materials necessary for you to convene the people on your block. And she did not know the people on her block. I mean, she knew them to kind of maybe wave at them, but she invited every single household to a meeting at her house. And many of them came. And then they also followed up with meeting and greeting the ones who didn't. And they talked about what kinds of resources do they have amongst themselves? Who were they? Well, Lisa was a nurse. Her partner, the far right, is a PA. What were some of the others? There was an engineer there. There was somebody who was a carpenter. What kinds of skills did they have? Did somebody have a generator? And did somebody have other kinds of supplies that might be necessary should there be an event? Now, San Francisco the big event there would probably be either a severe storm or an earthquake. And so being prepared for whatever that catastrophe is what Cool Block is about. But there's a specific overlay of building sustainability efforts into your community. And so that's what's wonderful about Cool Block. And there's a video that can help you all just learn a little bit about how you can build more sustainability, more community, build fellowship within your community, which builds your resilience to all things. And so she was very involved in this, and now she knows all her neighbors. They take care of each other's pets when they go away. I mean, they have built a community, which is what we need to be doing more. And so building the capacity for us to meet and greet each other, to assess our talents and resources, to become more sustainable and build community. This is a nursing role. This is a way that we can, I think, address many things that we're facing right now, including communities that are have less social infrastructure. This is another case study. Alexis Duran is a Latina, the woman on the top right. She's a nurse. Both Lisa and Alexis are part of the California Nurses for Environmental Health and Justice. And several of the people on our leadership council did training called Map Your Neighborhood. This is, again, a particular process where you meet and greet with your neighbors. And in Alexis's role, she did it within her apartment building. It wasn't even a block. It was her apartment building, of talking about who lives there. Are there people in the apartment that have special vulnerabilities, either maybe visually impaired or hearing impaired, or have mobility issues, or any number of things that I noted in the whole long list of vulnerabilities. And so in mapping your neighborhood, this was another way of identifying resources and each other, and being able to address sustainability, building community, building the capacity to address these kinds of catastrophic events. And in our communities, we need to be reading our climate action plans, engage ahead of time in our community-based organizations that address disasters and have disaster plans, including your faith-based organizations, but then also organizing neighborhood resilience programs. And I mentioned Cool Block and Map Your Neighborhood, but Transition Streets is another international one that was started in England. And if you just Google Transition Streets, you'll see another wonderful program for meeting and greeting and building resilience. So I firmly believe, as a nurse, that our preparation as nurses can save lives. It can save lives ahead of time. It can save lives during the disasters. It can help rebuild our communities with many more resources, much less stress, much less mental health symptoms, and so on. And I thank you for giving me this opportunity to share this with you, and hope we will have, I think we do have the time allotted for us to talk about questions and answers. So thank you.
Yes, I'm Dr. Karen Duderstadt. I'm here in San Francisco. I'm a professor emeritus for the University of California, San Francisco, and I taught for many years in pediatrics and worked as a pediatric nurse practitioner. So I will be giving Barb several questions. We had very many interesting questions in the question and answer today. Let me just look for the first one here.
And I'm amazed I left the proper 10 minutes for questions. Oh, you're muted, Karen.
Thank you. We had many comments on enjoying your presentation. So we have several questions. I want to get right to them. The first question is, nurses provide many services and take a wide range of roles in disaster situations. How can we prioritize these roles to make the required impact?
Well, I think that there are some if we're talking specifically about preparing for floods and hurricanes, I think that there are a set of basic sort of competencies that nurses should have. I think you should understand how will disasters be addressed in your communities? What are the resources in existence there? If you're a nurse faculty, I think you need to be incorporating disaster planning, preparation, response, and recovery into your curriculum. And there are some real basics to that. And so I think that if you look, Benima, what's her last name? There's a faculty member at Johns Hopkins who's written a book, Disaster Preparedness, a textbook, Disaster Preparedness for Nurses, that's got all the basic elements and priorities for that. But knowing your own community, that's what's important. It's not sort of knowing this information in terms of theory. It's really what are the kinds of disasters that are going to happen in your communities, and knowing how your communities are prepared or aren't prepared for that. So I hope that was a little helpful.
Thank you. Yes. The next question is says, how do we go about assisting those who are struggling with poverty in preparing for emergencies, as they may struggle with lack of resources to be able to make a go bag or afford to leave early?
Well, I think anybody can make a go bag. I mean, unless they're a homeless person, and they're already gone. I mean, they're already going. So, and I don't disparage that. I mean, I think we have to have a whole plan for people who are unhomed and in areas where a flood might happen. But I think there are real basic things, a change of clothes. If you saw that there was Tampax or Kotex, or having things that are extra, having some medication for a few days. If you're on medication, if you're a poor person and you're on medications, you can put some of those into a plastic bag. So while absolutely we've got incredible disparities in resources, anybody can make a go bag. And should have them for their children as well. And it doesn't need to be in a nice, lovely, Louis Vuitton suitcase. It can be in a plastic or another sustainable product bag.
Thank you. The next question is about those who are disabled, particularly people who cannot drive and or have equipment needed to move or survive. How can they plan for an emergency, and what can we as nurses do to help them with this plan?
Yes, that's a terrific question. And one of the things to note is that when thinking about who prepares for disasters in your community, look at the advocacy organizations who are advocating for the blind, who are advocating for people with mental disabilities, who are advocating for the homeless, and working with them in order to, and your communities undoubtedly have some center for the aging or senior centers. So how can you work with those existing organizations to make sure that the communities they already serve are also really aware of how to incorporate this additional layer of information for their populations? And what you'll learn is many of them are already thinking about this. So it's connecting the dots for us in our communities.
And there was a question or some confusion about one of the terms that you used, Dr. Sattler. Please clarify what you meant by culling people from the herd. Culling in some cultures implies to death. Is that what you meant?
Ooh,
or letting some
no.
Land for themselves. And
Sorry.
The other part was letting them fend for themselves to keep them away from differently vulnerable populations. So I think it's a matter of culturally what the term means. If you could just clarify that for participants.
Sure. So I'm going to give you an example and you'll see what I'm talking about. So, and this is an example from Katrina relief, when we had so many thousands of people that we were trying to register and get in. And there literally was a man on telephone, literally pulling his hair out, and was incredibly distraught. And so one of the Red Cross people there knew immediately what to do. I learned during this process, and she went over to him and she brought him outside, and they were able to identify a motel. They actually took over a motel in the area, they were able to take him and create a safe space for him and have a mental health worker with him. And so by culling, I meant taking him out of that area where he was getting triggered by what was going on, and the community there was getting triggered by him exhibiting these mental health symptoms that were so clearly upsetting. And so bringing these people to a safe place and then making sure they're being taken care of in the way that they needed special attention. And the same kind of special attention may be true of a vulnerable elderly person who is clearly sick. We need to create a safe, quieter space rather than this big giant gymnasium with 1 million cots in it. You know, how do you, to the extent possible, it might be a large closet that you're going to be taking some person to so they can be quieter and safer. I mean, we had people in line for their FEMA checks in labor, and they wouldn't get out of line because they said that FEMA check is the only money I will have for me and my child. That's how extreme this is.
That's very helpful, Dr. Sattler. Let's go on. We just have a few more questions. Could you discuss the challenge of communication during and after a disaster? And how can nurses help address these challenges?
Yeah, so I have to say that cell phones are making life, on the one hand, terrible, and on the other hand, very helpful during these events. But the cell phone lines may be down. So that's why it's really important in the immediate afterwards of an event that people know where they're going to meet their family members or whoever's precious to them. And that's immediately thereafter. But what we've learned, and I've learned in having been involved in more of the emergency response, is these giant trucks with cell towers, mobile cell towers, come into the communities. They are staged all over the country, and they come into the communities. So cell service will be up sooner than perhaps even electricity. And so that's how we will be communicating. That's definitely a step up in the right direction. Now, will that happen in our rural communities, less populated communities, countries that are more developing, you know, at this point in time? No. And so for nurses who are in those communities, you'll have to think through what are going to be the best ways to communicate across communities that might be isolated and so forth. And so having something in place ahead of time is going to really be helpful.
Another question that we have today is, what strategies can we as nurses use to get neighbors and others to accept the reality of climate change or impending disaster?
Well, so I think that we don't have to use in a community where there may be some, let's just call it hesitancy about climate change, that we don't have to use the word. There's no reason to be triggering a conversation, but anybody can talk about the fact that we're having extreme storms. It's on Fox News, it's on everybody's news, right? Mm-hmm. So how do we prepare our communities for extreme storms? And those cool block and transition mm-hmm. street, those are wonderful ways of pulling our communities together, of not having to say the word climate change, but rather, how do we build our communities on the common ground that we know we all have, And so doing things through our faith-based organizations, where maybe our faith is what is our common ground, even though within our faith-based organizations, we may have some who don't believe in climate change. And, yes. And it's okay. It's okay. Yeah. We're preparing people for disasters in this context.
I would agree. We're just about out of time. We have a couple of minutes, and there was a question about certificate of disaster nursing. And could you say just a few minutes about that? We may be able to send out a follow-up email to those participants for those who are interested.
Yeah. So, okay, I'm going to have to get the precise information so that you can send it out. All I know is that at the University of Alabama, they have incorporated it into their curriculum. And so I don't want to just say something that's meaningless. I'll find out the specific information, put it in a paragraph with a link, and send it to the organizers, and then I can get it to you.
Thank you. That'd be very helpful because we have a lot of listeners globally from many countries. We're so happy everyone could join us, and that could perhaps be used as a pattern globally to prepare nurses in their setting. So I think that's all we have for today. Thank you so much, Dr. Sattler, for your excellent presentation. Thank you to all the participants from all the different places I could see in the chat. We're so glad that you can join us. We look forward to seeing you from session 5. And yes, please have a good rest of your day, evening, morning, wherever you are. Thank you very much.
Can I just say one more thing, please, quickly? And that is that California Nurses for Environmental Health and Justice has a 4-part webinar series on disaster preparedness that Sahar Noorandini Sar just put together for us, and I will send the link to that. It's a free webinar series.
Thank you so much. We'll distribute that, Dr. Sattler. Thanks very much, and thanks everyone for their presentation, for their participation, and thank you for your presentation.